Good day, everyone. You're welcome. Federal Neuroscience Hospital, Yaba, Lagos. Good afternoon, good morning, good night. It's a pleasure of being here on this webinar once again. Our monthly webinar on Freedom of Voice of the Federal Neuropsychiatric Hospital, Yaba, Lagos. It promises to be a really wonderful time today because we have key experts here who will be discussing with us this very important topic that we had set out to bring for you this month. But before we go to the webinar proper, the medical director, Dr. Olubenga Adekilewoye, is here to welcome us formally to this webinar. Over to you, sir. Over to you, the medical director, sir.
Thank you. Thank you very much, Sakidoise. Thank you so much for welcoming me to this program. Good afternoon, everyone all over the world. I welcome you to today's edition of our regular webinar by Yaba Voice on mental health issues. Yaba Voice is a platform for mental health education, advocacy, and community outreach. It is a platform of Federal Neuropsychiatric Hospital, Yaba, Lagos, through which hospital create awareness and educate the populace on mental health issues. Today's topic is substance addiction among adolescents, the surge, the implications, and the solutions. As we all know, more and more young children are now living in drug-like circumstances and are actively engaged in drug-using behavior. Recent data show that incidence and prevalence of substance use and substance use disorders among children are increasing across a range of socio-economic strata. The WHO reports that up to 90% of children living in street-life circumstances worldwide use some kind of substance. And this creates a large burden for the family, for the community, and pose a great danger for the future of the family and the country in general. Hence, they need to create awareness and adopt a preventive approach to this problem. In today's webinar, the following questions will be answered. 1, what does substance addiction among children and adolescents entails? What are the risk factors associated with this condition? How do we recognize the problem early? What and where are the available solutions? And how do we prevent the problems from occurring? To do justice to today's topic, our seasoned expert in mental health care issues in child and adolescents. The first guest speaker on this program today is Dr. Grace Temitayo Ijarowe, a chief consultant psychiatrist special grade 1, an internationally certified addiction professional, and the head of Children and Adolescent Mental Health Services Centers of the Federal Neuropsychiatric Hospital, Lagos. She is a fellow of the National Postgraduate Medical College of Nigeria, a member of the West African College of Physicians. She also holds masters in child and adolescent mental health from the prestigious University of Ibadan, and she is a master trainer in substance use disorder of Colombo Universal Treatment Curriculum on drug abuse treatment and prevention in children and adolescents. Our second guest speaker is Mr. Oluwaseyi Awe, a seasoned child and adolescent clinical psychologist with over 10 years experience at the Children and Adolescent Mental Health Services Center of the Federal Neuropsychiatric Hospital, Yaba, Lagos. He has masters in clinical psychology from the Premier University of Lagos. He is a member of the Nigerian Psychological Association and Nigerian Association of Clinical Psychology. Our presenters are fully loaded with evidence-based approach on today's topic. Kindly relax and listen to our mental health expert as we promise you a rewarding session of today's webinar. Thank you.
Thank you, sir, for that arousing welcome. And you know, when the medical director and the chief host of Yaba Voice was reading out his welcome, it was talking about a figure, and it was talking about 90% of people living in this kind of environment. I know it comes across my mind, are we sure that's actually the case? Because when you look on our streets now, virtually every street, every corner, every angle. I don't know if I can be bold to say that in virtually every home now, this issue abounds so much. And it's becoming so devastating for a whole lot of family, not just even for the child that is involved, but even for family members, the society at large. And yes, I recall when we were younger, yes, we all experimented with chalk and smoking mats and every other thing. But it seems to be getting out of hand, and that's why we're here today. We're here to answer so many questions. Please, if you know someone who needs to be here, kindly prompt them and tell them that we had started this webinar, and so that they can join us as soon as possible. This promises to very, very enriching for everyone. Yes, educators, the family members, the school administrators, virtually everyone that's involved in their care. Please, let's the adolescent care. Let's reach out to them that we had started. If you are finding or having difficulties joining us even on the Zoom platform, please join us on Facebook. We are also streaming live, and so you can have direct access to whatever we're doing here live on that, and we will try and take questions too on that platform. So as we're going on, so we would be taking questions and comments on the chat box. So please, you could just send in your questions and your comments to that chat box, and then we'll be responding as we go on. To kickstart this discussion for us this afternoon is Dr. Grace Ijarebe. Like the medical director had earlier said, is that we're looking at substance addiction among adolescents, the surge, implication, and intervention. So Dr. Grace Ijarebe, over to you, ma'am. All right, sorry, a bit of technical itch there, but Dr. Grace Ijarebe will be joining us shortly. Yes, she's really prepared to give us very pertinent information today about what we want to talk about. Please, can you take this? Give her this, okay? All right, so she's here and ready to talk to us about this. Good morning, ladies and gentlemen. Good morning, mothers, fathers. We can't hear her. We can't hear. All right, sorry, we're still experiencing this itch, but I promise that we would do something about it. Yes, the surge in mental addiction, or sorry, what's it called? The surge in substance use addiction. It's something that has become so problematic, like I said earlier, in our environment. That has affected a whole lot of things, a whole lot of people. And it has made it quite difficult for people to be able to function and to be able to do well, so that it's not even really encouraging for them. And that is quite problematic to quite a lot of people. I don't know on your street if you have noticed that in virtually every area, virtually every place, it's there, and that is really problematic. We're sorry, we're just trying to just address this as soon as possible. Dr. Grace Ijarebe will be here. We're sorry about this technical itch. It does happen in virtually everywhere. All right, so she's on now. She's on now.
Okay, my name is Grace Ijarebe. I'm a mental health specialist, and I work with children and adolescents who have difficulty. I work with children who have difficulties and children who use drugs of abuse. So what are substances of abuse? What is drug addiction? What is drug addiction? This is the seeming incapacity of the individual involved to be able to abstain from the use of those drugs. And we have not, when you say drugs, people tend to think that it's just maybe smoke or weed. But these days we are beginning to have substances of abuse that include pharmaceutical drugs, drugs like codeine, drugs like, that's our regular cough expectorant, drugs like ketamine, which is an anesthetic, drugs like painkillers, and drugs like amphetamines, things that children use as slimming pills. And because of this, we have so many issues in the community now involving young people. At a particular point in time, some years back, we never have thought that children will be involved in the use of psychoactive substances. But it so happens to be that now children use a lot of psychoactive substances. And we found that almost 50% of young people have experimented with drugs. About 30 to 40% are using drugs regularly. And of course, we have about 9 to 10% of them who have problems using drugs. Let us know that drug addiction is a brain disease, but this is an interesting kind of disease because it does not start until somebody is exposed to it. It's now been known genetically that some people have a tendency to have a drug problem if they have the initial exposure. So once children and young people don't get exposed, they might actually carry this gene, but they'll never express it. So they'll never become addicts. But if there are people who have this gene and they are exposed to drugs, then they could become addicted. And it's known that almost 9 to 10% of people who experiment with cannabis or alcohol will become dependent or become addicted to it. It's much higher for things like the hard drugs, those ones they call heroin and cocaine, because people that use that will also become addicted to it. And it's most likely that 1 out of every 4 that uses this drug are going to become addicted. So you can see the problem that we have. Why are we not able to stem this problem when it started? And the answer is not far-fetched. This is because nobody is expecting children to go and use drugs, okay? And we have so many risk behaviors that actually would encourage a child to go and take substances. For instance, in some people's homes, they have cabinets, they have drug cabinets. They have bars that have alcohol, they have all this champagne wine that they keep, in like some kind of tantalizing array of look, in their parlors or in their sitting room. And they don't expect the children to go there, but the children are taking them. So children are using substances. They are getting it from people that sell even things like bread on your street, or the malams, that, guard the gates. Many of them sell psychoactive drugs. And even within the school compound, the school premises, many of the vendors who are within your school, you've got to be very careful because they could be peddling drugs. And once they do that, the children will buy them. When you say people are on drugs, people think that they have to be rich or they have to have a lot of money. But this is not so. Because cannabis, the one they call weed, sells for just 10 naira a wrap, 20 naira a wrap. And most school children can afford that. Imagine a child that takes 100 naira to school for break, and then one is encouraged to smoke, for the next 12 hours. So you have all kinds of people peddling with them. So we have drug use among children, and all of us as adults have got to wake up. Are you in the school setting? Are you at home as a parent? Are you in care of children or adolescents? Are you in charge of an institution? Know that a lot of young people are using experimenting with drugs and are also having problems with drugs. So how the environment is probably using drugs, okay? So their behavior may change, but that comes almost money, picket money, okay, to go and get this drug. So if money is getting missing in the course of perpetual business in the house, Don't ignore it and say, maybe I spent the money. Bother to check what is that the drinks are gone. You know, don't I've had a hard day. You know, like nothing happened. A lot of things. We also have that, you know, access to school, beverages, coffee, energy boost drinks that have a lot of caffeine. All these things are psychoactive substances. A lot of girls that want to slim, especially plump girls, you know, they want to look slim like and trendy like in recent times. They go out and have what you call teas. And these slimming teas are psychoactive because they have amphetamines. And amphetamines can make people go, in quotes, crazy. Okay, so it's a very, very dangerous thing to use. And our children are using it perpetually. What do you do when within your environment your money is getting missing or things are getting stolen? All the children are disappearing.
People that use substances, they tend to disappear. When they go out and source these substances. They have periods where they go out and source the substances, and they find that they have periods where they go out and source the substances and they're not at home. And most parents will just come and say, where is my child? He's not around. And they overlook it. Bother to know where the children go when they disappear, in quotes. So supervision time is very, very important for most of us at home out there. When the child closes from school and has to hang around for so many hours before getting home, know that that is a very risky period, that the child can get into a lot of mischief and begin to use drugs. When children close also from school and they get home and there's no adult supervision because the mother is coming back or the father, the parents are returning at 9 p.m., it's a lot of time for children to get into mischief. So our children continue to get into a lot of trouble because of all the dynamics that are playing on around us. And so our watch, the word is eternal watch, eternal vigilance. You must be deliberate in your actions to prevent your child from getting into drugs and from persisting in its use. Ask questions. Anytime you find that your child has the eyes are perpetually looking red, the child is very cantankerous at home, is disheveled, not taking care of himself, is looking sick, everybody's complaining that the child is unruly, please ask questions. Bother to look for help for this child on time. Many times when you ask people who are using substances, they will deny, they will say they are not. But if you bother to get them into a hospital, they'll be tested and it will be found that they have these drugs on them. So it's about time that everybody woke up to the reality that drug is a problem in our community. It's a serious problem. And so when children's academics are falling, please be vigilant. When children are, sleeping throughout school hours, be vigilant. When children are not in school and not at home, when they are supposed to be in school, it's time to be more vigilant. Where are the children? Thank you. Thank you so much, Dr. Gracie Jarigbe, for that wonderful presentation. I know we're experiencing some bits of each technically, but so sorry, just pardon us. We will do everything to correct that as we go on, even in this webinar this afternoon. So please just note your question. If there's something that you felt, I needed this information and you've not heard it, you could just send it in the chat box. We will take it up and then they would be just willing to just talk about it all over again. But Dr. Jarigbe had given us a brief definition of what addiction is. And then more importantly, she also told us some of the reasons or some of the possible causes of things that happen. Actually, when people have, yes, fancy bars, they look very elegant, they look very beautiful in the house, but it could also be a trigger, it could be a risk factor for people to, or young ones to start using substance. Sometimes she said that they could use hard water to the content. And so you as a parent will still look at it and the content is still filled up, but actually it's not the quality or that was in there that you are actually finding there again. Also, she also mentioned something very pertinent, and that's one thing that I know I'm going to take away from what she had said this afternoon. And that's the fact that most times money misses. Most times we are not just accountable to our pulse. That's the word she used, that we are not accountable to our pulse. And so because of that, money misses, you just assume, but that it costs so little for those children to get marijuana. And because it's so cheap and it's about everywhere, you may not even know that, yes, money is missing and they're using it for substance. And the fact that it's now been added to virtually everything that these children now take. And that also affects them to a very greater extent. You find out that, yes, it's added to drinks is that they buy in school, the biscuits, the cakes, and every other thing. That's in itself. It's also something that we should now begin to look at. And she mentioned something which is very pertinent. Said most children will deny ever using. Most times they will deny. And so it gets to you being now on your watch, understanding how to identify it, and then moving on. And then she also ruled out some of the symptoms, how you would know declining academic performances, interaction, withdrawing to self, and quite a whole lot of other things. And these are some of the things that she had reiterated on about this topic this afternoon. And so moving on to the second presenter, Mr. Sheyi Awe, who is also going to share his thoughts on this topic, substance addiction among adolescents, the surge, implication, and intervention. Over to you, Mr. Sheyi Awe.
Thank you very much, Secretary Sheyi. Am I clear now? All right. Thank you once again, Mr. Secretary, for introducing me. My name is Oluwaseyi Awe. I'm a child and adolescent psychologist. I also want to thank Dr. Jaragbe for who had already started. I will be continuing on what she has said. Even though we know that drug addiction or substance use disorder is a great concern, what is of greater concern is actually the causation or the root causes and the implications and the other things that lead to addiction. It's worthy to note that, can you hear me? Oh, okay. It's worthy to know that even though that there are risk factors to these things, there are a lot of people, they go into addiction as a reason of maybe experimentation, they are inquisitive and the likes. But we also know that a lot of people go into addiction as a form of self-concept issues. A lot of people go there because they are looking for how to medicate or take away something. A lot of people that have self-concept issues are a result of emotional dysfunction, or emotional disconnection with family members, people that come from parenting that are coercive, places of abuse, neglect, inattentive parents and the likes. And we know that many of these things, there are questions to it and they have psychological consequences. I'll give you an instance. There was one time that there was an interview going on with a young man, with my colleague, and they asked him that, what are the things that make you want to go into substance and all that? He said that the reason why he goes into the substance, because whenever he takes a drug or he takes a puff, that it gives, it's like he is receiving a warm hug. That shows that there's an emotional disconnection from this child. Also, the instance when I was talking to a young lady and I asked her that, okay, what are the reasons why you think you need this? She said because it substitutes or it substitutes and it fills in for the pain of the trauma that she received from the sexual abuse that she had. Because these things are more than even the addiction itself. They are using it to medicate and they're using it to live up these things. And as time goes by, it becomes an addiction. And of course, there are psychological consequences to this thing. And the top of that list is low self-esteem. A place where you feel that the only way you belong or you are accepted is by taking these substances, by that, I will not be able to be with this peer, I will not be able to roll with these people if I do not take this thing. Also the place also a place of emotional dysregulation. You see a lot of adolescents that they have incessant mood swings. Their mood is either here, there, labor mood and the likes. These are psychological consequences. Academic underachievement. A lot of them are underachieving in academic because they cannot concentrate in class because all they think of is just to take the substance. That if they don't take the substance, they are not able to even concentrate. So this thing causes a lot of problems in their educational progression. And we see a lot of adolescents that are aggressive. Verbally, physically, at any little thing, they are breaking, destroying things in the household. They're talking in very, very uncouth manners. And you're looking, these are those changes that you start to see in children that are started even going from a place of recreational use into the place of addiction, because this thing is now pertinent to their lives, and it is the unknowing to them is already giving out all these psychological consequences. But these are the things that we should be able to look out for, to know that, wow, there's a problem, start to investigate and know that these are things that are happening. And there's, as I said about emotional dysregulation, if emotional dysregulation is not even, if it's not tamed, if it's not resolved at an early age or an early stage, rather, these things progress to conduct disorder, which has a form of personality traits, which eventually becomes personality disorders. We have also adolescents that show form of high irritability at every snitch, at everything. They are irritable. They at any stage of talking to them or conversing with them, they just check off and they're irritable. And these are those signs, those little signs that become something that is out of proportion. Also, we have people, we have adolescents that have impaired judgment. Their thought of reasoning is very skewed. The way of carrying out individual tasks and all those things, is questionable. And start to look at these things, that why is this child behaving like this? You should actually start to suspect that this child might be involved, or might be in a place where he is with the wrong or negative fears, where he or she is taking substance or substances. Loss of interest that eventually leads to depression. You see a lot of these children, there are lots of interest in the normal thing that that this child will normally participate in, but this child starts to withdraw. Maybe he's always in the room, always hiding, always going to the backyard, always going to one consistent place and say, oh, I'm coming and all that. And you say, why this thing that I used to do before, that I used to like, that I used to, no, I'm not doing it anymore. These are the things that with the signs, are the things that we'll start to look out for, because these are the psychological consequences that come from substance use disorder. Also, at the place of anxiety, they're always having fits. You see them, they're jittery in their stances, that they are shaking their legs, either they are always tapping their feet. These are things that we start to look out for. And there are so many psychological consequences. However, to mention just a few, at the time when we are noticing these things, the best thing is to always take these children, when the investigation, take these children to a hospital, as Dr. Jagbe earlier said, for a drug test, and preferably, a child and adolescent mental health care center. The reason why I say that is because we have a collage of team members, that are specialized in treating children with substance use disorder, from the psychiatrist to the child and learning psychologist to the psychiatric social worker, because this child is not looked as seen as a single unit, seen as a whole unit, because there are many things that might have affected or caused this child to be addicted to this drugs. And in the place, the centers, that is the child and adolescent mental health centers. What we do before is basically treatment plans. Before intervention, what we do is assessment. So clinical interview is the gold standard anywhere, or in the child and adolescent mental health center, to be able to ascertain and also build rapport with this child, because you have to put into cognizance that, as Dr. Jagbe had said, that there is no adolescent that will admit that they take substance. So that child is already coming with defenses, putting lies under tonation that, oh, I'm not doing it, they're just suspecting, even though you bring a urine toxicology report and show him that you are taking, say it's a lie, it is not, and all those things. However, as a therapist, you have to be objective. You have to build a rapport with this adolescent, because these things have been shown through research that it has worked tremendously along the years. Build a rapport in a non-judgmental way, because you have to build that rapport to carry a process with that adolescent, because that adolescent will not open up to you if you don't make that adolescent at least gain a little bit of your trust. And motivational interview techniques have achieved best results in all these things. Also, in the place of assessment, there are so many things you look out for. Now, yes, we might have said that some people go through this thing in the place of experimentation and the likes. But also, we know that their research has also shown, and even through experience, we've seen that a lot of children that are born with neurodevelopmental disorders are more likely to take substance use, people such as people that are diagnosed with ADHD, that is attention deficit hyperactivity disorder, usually go into substances among the likes. So these are things that we look out for in the developmental history. And enough information should be collected to answer the following questions. What factors predispose the adolescent to the use of substance? What precipitates or substance use, and what were the triggers for that patient to even come to this place? Are there perpetuating factors that make it difficult for the adolescent to abstain? Does a family member, that's his parents, someone that person looks at as a model, does that person even abuse or misuse this substance? What about the peers? What about these peers that's person around? Because these are things we need to look at in the place of assessment so we can know how to draw a proper path of intervention. Are there protective factors that we can use for this adolescent? Because many times these children are just victims of circumstance. They are in the place where these substances are everywhere and they cannot protect themselves. This is where we bring in, that's why we bring in psychiatric social workers in partnership with third parties that know how to protect this child in the place of assessment and all that. And also we have many objective assessment tools that are, well, that we cannot mention because of time. But after a comprehensive assessment has been done, that is the young person and their parents or the people that are caregivers to them should be involved in the planning of the treatment. Treatment goals will largely depend on the motivation and the circumstances on each individual. The level of care required will be determined by the intensity and the complexity of the presenting problem. So that some of them, they come in with mild symptoms, some moderate, and even very severe. So through assessment, we'll know the intensity and the complexity of the presenting problems and the need of the patient. And the management plan should be realistic. It should be acceptable to the patient and family and feasible within available resources. And after this assessment, there are so many intervention plans. I will just be scrolling through an array of intervention plans, such as motivational interviewing, relapse prevention programs, contingency management, family-based interventions, self-help groups, cognitive behavioral therapy, and multimodal psychotherapy. Because I said that after assessment, depending on the intensity of this adolescent's need for intervention, sometimes what works for this child will not work for the other child. That's why sometimes just a single form of intervention can work. And at times, it's the multimodal therapy, which involves the different intervention plans to make this child better, because the main goal is to draw a custom-fitted intervention plan for progress and treatment to this client. Thank you very much. Thank you very much.
Thank you very much, Mr. Sheyi Awe. That was really, really loaded. I don't even know where to recap from, but I heard him say that, yes, part of the issues has to do with self-concepts, especially for adolescents. And what was running through my mind when he mentioned that was the fact that the adolescent stage is also a problem-laden stage in itself, because it's an era where they're coming into adulthood. They are not living the childhood era, and it gives them identity crisis and quite a whole lot of other things. And so the need to discover self becomes it's a major problem already. And then now adding substance to it, and quite a lot of them also feel the pressure to be part of the group. They want to align themselves to a particular group and other things like that. And that's part of the things I hear. And it also went on to say there are personality traits that you will see in a child that would tell you that there is a likelihood, there's a chance that this individual might likely go into substance if it is not coped as early as possible. I also hear him now talk about, he's still going to explain all of that to us, because it's not all of us that understand big grammar. He was talking about precipitating, perpetrating. What are these particularly? We need to understand it before, for laymen like us now. We need to be able to understand what are these precipitating factors, what are these perpetrating factors, so that we know what to watch out for. That's why we are here today, to have a basic understanding, because we're looking at the surge. And this surge that we're talking about, it's virtually alarming. I don't know if it's alarming for you, but it's alarming for me as a parent, because it's really, really, it seems to be very problematic all over the place now. Virtually every corner, even if you're not, I was telling someone, I said, right on my street, I was walking down one day. I know the guys were blowing it. It was their house. I couldn't say stop blowing, but please, I inhaled so much that when I got into my house, I needed to put water on my head. I went under the shower because my head was vibrating. I don't know how they do it. I don't know how they go, but really, it was a very terrible experience for me. 2 hours, I was just sitting down and looking dazed. And everybody kept asking, what is that? I said, I inhaled marijuana. Just inhale. And it's like every one of us is just inhaling it now. It's there all over the state. Factually, I would even say if they test every one of us, honestly, they will find marijuana in our blood. I am very, very sure they will find it there. And that's the situation we are now. But like I said, more importantly, the adolescent stage with this that we're talking about. And I'm going to ask Dr. Grace Ijarigwe to also help us now. How can we manage this adolescent stage? Because parent needs to take something away from her. How can we manage this adolescent stage? Because we know it's a crisis-laden stage with this topic that we're talking about today. Thank you, Mom.
So how do we manage the crisis that we have? We know now that there are children that are using substances. They are already there in the community. And there are children who are planning to use. So it's going to be in two approaches. How do we prevent those that have not started from initiating use? And then those that have started use, what do we do with them? And those that have used to the point of developing problems, how do we handle them? For prevention of initiation, call for community stakeholder intervention. So it has to be there that in your schools, they don't sell drugs. On the way to school, they don't sell drugs. Within your school, nobody's selling these children drugs. Your staff, the people that are your house staff, it's not enough for you to say, I really don't care if my driver smokes or if my cook, uses cannabis. It's not me, because you have young children who are impressionable, who are living in that environment, and be sure that they are going to experiment with it. So you have to keep the environment free of drugs. How about the children's emotional, development? Because if you don't attend to the emotional development, like Mr. always said, they are going to identify with other people outside in the community who are going to introduce them to drugs. Do you listen to the children? Some children have gone to their parents to tell them, take permission to use substances. And the parents absent-mindedly said, you can, it's okay, you can use it, you are disturbing me. And then the children went ahead and, went to smoke. And when everything came down, said, Mommy, but I told you, and you said, it's okay, I could go ahead. I said, I wasn't listening to you then. You've got to listen to your children. There are many of these children that will come home and they'll give you some gimmick stories. Mommy, in case, and this, and they give you one scenario. And you don't pay attention, just send them away. I'm not ready for stories. You've got to listen to your children because they'll talk to you first. So let's learn to listen. Another thing that we can do for those that are already using. Remember, we talked about being vigilant in your environment. Teachers, please be attentive. Children are using drugs in schools. We have many schools that will deny and say, never, never, they don't use drugs in our schools. But let me tell you, 98% of the children that come to us who are using substances are in school. So schools, there's drug abuse going on in the school. So the teachers need to be trained. They need to know what is going on. Many teachers don't, even if there's no cannabis in class, some teachers cannot detect it. They just come and say, what are they burning? And that is it, okay? Because they do not know. So the teachers need to, this is not the age of ignorance for teachers. These teachers need to know. They need to know what the substances are, what they look like, what people who use them, how they behave in class, and how to attend to those children. Children have been sent out of school. They just say, they are always fighting, and then they just dismiss, and maybe they expel out of school. But the child is always fighting because the child is on drugs. What the child needs is help from drugs, not dismissal from school. So we've got to get to the depth of the problems that children have in school before we, recommend that expulsion or the extreme measures that we normally do in school. A lot needs to be done. For the hospitals that are taking care of the children, let me come to the hospitals, because a lot of problems that generate from intoxication and overdose of drugs, they are going to go to hospital. And I'm not talking of a mental health center. They are going to go to general hospital. They are going to go to local government hospital. Are the doctors who are there equipped to take care of overdose? Because a child who has overdose and comes to you, you know how to know what you have to do. First, to save the child's life, and then second, to now say, how do we rehabilitate so that this does not occur again? So a lot of intensive things need to go in terms of community and all that. And then finally, for the rehabilitation of those that have a lot of problems, we say do not truncate the child's future. And we make a special appeal to school authorities. If any child is caught who is using drugs, send the child to go and have to be rehabilitated, but give them the opportunity to come back and re-enter school. If not, they will complete rehabilitation help to make sure that there's no problem.
Thank you so much, Ma. Dr. Ijarugbe had given virtually solutions to every angle, every structure of the society, right, starting from the family, right to the school, to the
To the
hospitals
hospitals
that
that
sometimes
sometimes see
those
those
children
children
before
before
the
the
expert
expert
professionals
professionals
now
now
coming,
coming and
even
even
to
to
the
the
government
government.
itself, being able to now deal with all of these things and then being able to manage it effectively. But I hear her say, listen to them. One of the things I have also found out to be a great problem in with this substance use, especially with the surge, and she mentioned it earlier, the time from school and home. What are these children doing? Supervision. We're still going to come back to you, Ma, on that so that we can know how can we balance this, because everybody has to work. Both parents are working, even the resources is not enough. So how do we balance it? You can't stay at home 24/7. You can't become a monitoring spirit in your child's life, especially when they even get to this adolescent age. They don't even want to be monitored. So how do we now balance it as a parent? We'll come back to you that. But then I'm going to now ask Mr. Sheyawe. Yes, we're talking about precipitating, perpetuating, and all of those things. We need to understand what are these factors in themselves. So parents and people on this platform are able to go home with that. I will know what exactly they are, and so that we can know what to watch out for. Over to you.
Okay. Thank you very much, Ms. Akitoye, once again. As you said, basic grammar. So I'm going to reduce, or rather, I'm going to say it in layman's terms. So, in the beginning, even I mentioned it, Dr. Jarbo mentioned it about genetic factors. So there are things that are predisposing to anybody. She said something that, if the person is not exposed to it, the person can carry that gene and carry on his life and nothing will happen. So those are predisposing factors. The situation, it could be genetic, it could be life events, it could be environmental factors that are there that are predisposing that person to be liable to go into substance use disorder. Then we have the precipitating factors, which are the cause. Like now, as I said about a young lady that I was interviewing, I said, okay, why is it that you take this thing? He said, because of the sexual abuse or the sexual abuse that she had encountered. These are the cause. What are the things that are now causing that thing to happen? Then the perpetrating, what is it? What is sustaining that thing? What is in the environment? That's why I said that even in that place, we'll look at risk factors. That is there something that is maintaining that thing? What is perpetuating that thing from happening? That's addiction. Is there something within that environment or around that person that is not far-fetched that person will continue to see or will continue to have exposure to, that will continue to perpetuate that person using substance that is addictive? So those are the things. I don't know if I'm able to say it in layman's term.
All right, thank you, Mr. Sheyawe. Yes, I just wanted us to understand this and not assume that everybody understands what is it that he just said earlier. But what caught my attention was the fact that he said, what are the perpetuating? I know what came to my mind when he said that was the fact that perpetuating might be the fact that substances are available all over the place in the environment now. Mr. Sheyawe, I'll come back to you. How do we deal with these perpetuating factors? Because we need to be able to understand how to deal with it. Now, I will go back to Dr. Jaribe. Issue of supervision, having time for the student, being involved and being available. And we have to work and survive. How do we balance it? What are the tricks or the strategies to doing this?
So, how do we make sure that the children are supervised? And these are some of the recommendations that we're making to schools now. For parents who know that maybe they are bankers or they work till nightfall or they are in traffic till nightfall, they can arrange for children to have what you call after school care. So after school care means that if they close school at 2 o'clock or 3 o'clock, there's a special session that allows them to be able to be retained within adult supervision till it's time to go home. Their parents can pick them up or close to the time that their parents will be, getting home. So the supervision is such that the child could have a shower, child can do their homework, there's somebody that they can have their siesta and all that. So it's not like a rigid school thing after school, but after school care can be done. Okay, so if we want to make sure that those hours that the children have are well supervised, we can attend to it. In the olden days, because a lot of the grandmothers were living with us, it was so easy. Because when the child is coming back, maybe the child normally comes back at 2:30 and comes into there at 3:30. Grandmother will alert from her chair and say, who's there? And look at the time pointedly. So the child knows what happened, why are you coming at this time? So children are not able to play so many pranks because there's an adult at home. But now, many grandmothers live within their own homes. They don't live with their children anymore. And so that adult supervision that the generation above us had is no longer there. And that we have to fill in formally. We may need to fill that in formally in terms of having people who are trained to take care of children after school. Also for children, we always say that when children are on holidays, that they are with their parents. It is not true anymore. When children are on holidays, they are even more free to do mischief, because now the parents go to work from morning till night, and the child is at home unsupervised from morning till night. So parents have got to arrange for their children to have supervision, especially for very, very young children, to have that supervision if they are going to be away from home for a very long time. It is absolutely important. Thank you.
Thank you so very much, ma'am. And so what Dr. Grace Arabi had recommended is the fact that there should be after school care. Don't just leave the child. Yes, an adult supervision is expected, and that child must be accountable. That helps that child to be able to function and then to be able to do so well. All right, so Mr. Sheya, we're perpetuating factor now. And one of the ones that I have been able to identify is the fact that the abundance of it all over the environment. How do we handle this? How do we deal with this? Because it has become our reality. Recently they caught someone in the eastern part of the country who was selling cakes, and they had, sometimes you don't even know what you are eating. So how do we deal with this?
Okay, thank you very much. So how do we deal with this?
All right, sorry about that. We're still having a bit of technical itch there. Mr. Sheyi would come up, but then let's just unmute Dr. Grace Ijaribe. There's a question here in the chat box that says, what do you have to say about adolescents?
It all starts from the foundation.
What do you have to say about adolescents who are already used to it? In fact, evidence abounds that when they take it, it assists them to concentrate well and perform well in class. I used to have a case of a boy when I taught in secondary school. So what do you say to this, Dr. Grace Darime?
And so there are some myths that seem like facts, and that is really true. That's what we see. The drugs, when they are taken initially, seem to help the children to be able to maybe sleep better, or develop appetite, or they think that they're a bit more alert in doing their tasks. But the truth is that it has done that it's like eating tomorrow's food today. So the substances that the brain is supposed to use at a later time has been used up today. And so the child is going to get to a time where there is nothing left to use. And the child is going to have mental health problems. I'm putting it literally. I'm trying to explain it literally so that, I don't want to say jargons, okay? I mean medical jargons. But if a child is using substances today to overfloat, maybe the child is not able to read well or is not concentrating well, and is using those substances to do that, then the child is investing in danger and in mental health, in mental illness for tomorrow. So what any child should do who thinks he's not learning well, or is not sleeping well, or is not eating well, or does not have good self-esteem, that child should go out for treatment. Some people are having these issues because they have mild depression. So waking up, being alert, getting about is a bit difficult, you know. They are a bit laid back in doing things. They should not use drugs to stimulate that. They should go to the hospital and get properly treated and be able to achieve their life's goals in a proper way that will not affect their mental health in future. So it's a lot of advocacy that has to be done among young people, because they'll tell you, look at that one, has been using it for, in short, 5, 6, 7, in short, this has been used for 10 years, and it's still okay. You are not the same. In short, that person that has been using it for 10 years that seems, you know, has been maybe not a problematic, you just regular use, is not one of the 10% that will become addicted. We have people, we've had stories in our institution where someone wanted to go abroad, you know, gain the scholarship, a very young person, 17 years old, wanted to travel abroad, and they held a party like a night or 2 nights before his flight was due to leave, and they served him cannabis and all these hard drugs, and he became mentally ill, and he's remained mentally ill and has not been able to go for that course. He's been ill now for almost 15 years. So you can never say everybody should abstain from substances and drugs of abuse.
Thank you, Dr. Grace Ijarigbe. What her hair has said is that even when the child uses it, it doesn't solve the problem. As a matter of fact, it's going to have a long-term effect on this individual later on in life. All right, please, Mr. Sheya, we're back to take his question now.
All right. So thank you very much once again, Ms. Akintoye. Well, as I was saying, I said that in the beginning, I said something about parenting style. So there's a question I will ask before I answer the question. A lot of us also experimented with maths and all those things, even though we know that the environment also was polluted with these things. But many of us did not grow to have any form of substance misuse or substance addiction because because of the kind of parenting styles that was able to accord us. You know, involvement of parents emotionally, cognitively, psychologically, and in every aspect. You have to be involved in your child's life. There is no essence in you making money to take care of this child if you will not be emotionally involved in your child's life. These are the first and the paramount things that you need to do because there will always be negative vices in the environment. There will always be negative vices, but the way you are able to imbibe knowledge and information into your child's life, and also as much as possible not be self-centered by you also abusing these things in front of your children, because these are major causes. You might say, oh, you are not predisposed to have any form of mental health problem, but if these children are seeing these things that they are modeling, and you are taking even maybe something mild, and they, because of that gateway, go and take something even more, dangerous and affects them, you would have yourself to blame. Second of all, community awareness is very, very important. We are not doing enough for community awareness. As much as this thing is in the environment, we should be at par with community awareness. As they are taking it, we should be informing people that this thing might be vices that can make you feel good for a while, but they are vices that can have enduring damaging effects in people's lives, and even not only the individual, the family. So I think these are about the things that we can do. And there are so much more, but these are the things I can think of the top of my head now and mention. Thank you.
Thank you so much, Mr. Sheria. You mentioned community awareness, and thank you, Bukola Olotu. You say it's important to do due diligence before committing any child to any aftercare giver, so that we are not putting them in the hands of more risk. Yes, we appreciate that. Yet today, Odeja is saying this is a great session that should be taken to all schools. I believe the problem is all over now. I wish Yabu Voice could help escalate this truth all over the nation. It's so deep. Thank you all. Yes, and we are doing what as much as we can in this little corner that we are. And then you also could be an ambassador sharing this. Yes, click on our web, on our platform, social media platform. We share so much this information there. So you could also help us share. You could also organize it. We'll be willing. Yes, just invite us. We'll be willing to come and also talk about it. This webinar is very great. Kudos to the organizer and presenter. Thank you so very much. That's for Caroline Obasoro. Thank you so much, Ma. Yesterday, Ojada is saying again, honestly, community awareness is so key. God help us. And so what we have started today it's what we would need to keep doing more and more for schools and for maybe organizations, community and outreaches of things like that. Yes, we will be willing to partner and to just give us an invite, and then we'll be there with our key experts to begin to talk about all of these things. Yes, from Jones, we said, yes, we need more advocacy. Yes, I so very much agree with you that advocacy is a key, especially now. Some of these children that are taking the substance don't even understand the implication, the health implication of it, or the long-term effects of what it is that they are doing. And so, yes, advocacy is very important. We want to say thank you to everyone who had been on this call with us. And so we're going to take final comments from our presenters. But then, Dr. Grace Ijarugbe, I would want you to, how can parents be supportive, especially when they have children who are using substance? Just take that with your final comments, and then we'll be rounding up. Thank you, ma'am.
Parents need to be non-critical. They need to help, and they need to not be hostile towards the child. Because once they do that, they will drive the child away from them. They need to be understanding, empathic with the child. So we have a way that we retrain our language. Instead of saying, you stupid boy, look at the problem you have caused the whole household. You know, you're in trouble and all that. Say, Jide, I know that, you know, you have developed a problem due to use of those drugs. And I know that you and I can try and sort this out. So you are going to be going to the hospital, and there are things they are going to be telling us to do, and we are going to do it. And once the child sees that you have that thing about drawing close to him and helping him, he sees you as help and not a threat. And more likely, everything you want him to do, he will want to do it. He knows he has disappointed you, and he wants to make up for it. And that will help you to heal the bridge. But once you drive the child away, then the time you even run away from home. My final comment goes straight to policymakers in the educational system. I have gone around the beat to the teacher training colleges, and I have seen that there's no mental health curriculum in the teacher training schools, institutions. I think for this, our generation, for our children, we dropped the ball somewhere. We must not do this for the oncoming generation. We need to have mental health curriculum with the teacher training colleges. Even if it's for an elective of 2 or 3 months, let them pass through a curriculum where the teachers are mentally aware. And so when they come to the classrooms, let there be a subject that is mental health education or whatever they're going to label it, so that there's a generation that is coming after us that will be totally mentally aware. Thank you.
Thank you so much, Dr. Ijarugbe. Mr. Sheyi, over to you, please.
Thank you once again for inviting me to talk on Yaba Voice. I'm very privileged. Last notes, I would say, you know, in the beginning, I also mentioned about in the place of assessment where there are also causations as a result of neurodevelopmental disorders and all those things. You see, early detection, if you know of any child that is already showing symptoms of probably excessive inattention, hyperactivity, and all these things, it is better that you start intervention from a very early age or very early stage, because we know that there is stigma in these things. You know, an early detection and intervention always helps to deviate from all these negative vices. And if you see any child that is having any of these symptoms or psychological implications that we have mentioned, please, we have spoken, we have said, take them to the nearest hospital. If you do not know where the child and adolescent mental health service center is, you can take them to the hospital for a drug test, and then they can rightly refer you. Because if you are able to start intervention early, then there is a good prognosis that that child or that adolescent will be able to integrate in the economy and still live a probably good life. Thank you very much.
Thank you so much, Mr. Sheria, for that submission. Yes, for everyone who had sent us a comment on this platform this afternoon, we say thank you so very much. Yes, Yaba Voice is trying to do their bit, but like I said, we all could be crusaders in ensuring that our voices are heard. Yes, our voice has been heard in this little corner, and then everybody joins forces together, and then we ensure that, yes, it becomes louder and the whole world can hear it very well. So I want to say thank you to everyone who had come. Yes, please, this advocacy should be made in schools and in mosques and churches too. Yes, I quite agree with you on that. And so I want to say thank you once again on behalf of the medical director and the chief host of the Yabo Voice, Dr. Lubenga Adekile Owoye, and every member of the Yabo Voice team. I want to say thank you for being on this call with us once again. We look forward to seeing you in October by the grace of God, which will going to be the World Mental Health Day. And for this year, mental health in an unequal world is a theme. And then we'll be looking at dealing with the realities and stigma of mental health, even on this platform, by the grace of God. We hope to see you then. Please keep safe, take care of your mental health, and ensure that you are a voice that can be heard. Go to our Facebook pages, our Instagram pages. We are there. Like us, share, send us comments. We'd just love to hear from you. We'll also love to just know whatever it is, whatever thoughts that you have, just share it with us, and then we would equally respond. And you can also give us a call if you need to also talk with someone. Until we come your way again, please keep staying safe and ensure that you have appropriate and adequate health that would help you to move forward very well. Until then, bye. Thank you so much.
Bye bye. Thank you. Thank you for coming on board.
Good, good.